Hello and welcome to our informative video about medicines. My name is Yahya Sultan and I am a registered pharmacist and I have done my graduation from University of Sawabi in Pakistan. So in this video, I will be discussing all about ibuprofen which is available by the brand names of Advil, Neuprin, Genpril, Medol, Motrin, and there must be other brands too, in which ibuprofen comes in combination with other active ingredients. NSAIDs are non-steroidal anti-inflammatory drugs which are divided into three main groups based on their selectivity for COX enzyme: selective COX-1 inhibitors, selective COX-2 inhibitors, and non-selective COX inhibitors. So ibuprofen is classified as non-selective COX inhibitor as it acts on both COX-1 and COX-2 enzyme, which will be discussed in upcoming slides. Now, to understand how ibuprofen works, we first need to look at the pathway of inflammatory response. What happens during inflammatory response? So following tissue injury or irritation which causes swelling and inflammation, an enzyme called phospholipase A2 is released, which converts phospholipids in the cell membrane into arachidonic acid. Now, arachidonic acid is a substrate for major enzyme called cyclooxygenase, abbreviated as COX. Now, the COX enzyme exists in different forms, two of which are COX-1 and COX-2. COX-1 isoform is expressed constantly throughout the body and it's primarily responsible for production of thromboxane and prostaglandins, which stimulate normal body functions such as secretion of protective gastric mucus, regulation of gastric acid, promotion of platelet aggregation, and maintenance of renal blood flow. Now, on the other hand, COX-2 isoform is not expressed constantly in most tissues, but instead, it is induced at site of inflammation. So unlike COX-1, COX-2 derived prostaglandins mediated mainly inflammation, pain, and fever. Now that we have discussed the role of COX enzyme, let's talk about mechanism of action of ibuprofen. So ibuprofen acts and inhibits both COX-1 and COX-2, which simply leads to decreased production of prostaglandins, and as a result, ibuprofen produces anti-inflammatory, antipyretic, and analgesic effect. Now let's talk about pharmacokinetics of ibuprofen. So ibuprofen is rapidly absorbed, which is 85% from small intestine. The bioavailability of ibuprofen is 80 to 100%. Onset of action is 30 to 60 minutes and duration of action is 4 to 6 hours. So ibuprofen is rapidly metabolized in liver mainly by cytochrome P2C9 and is excreted through renal route. Now let's talk about indication and uses of ibuprofen. So ibuprofen is used in headache, dental pain, menstrual cramps, muscle ache or muscle pain, rheumatoid arthritis, and osteoarthritis. Adverse effects are always associated with medicines, so adverse effects that are associated with ibuprofen are GI or gastrointestinal effects that can extend from dyspepsia to GI bleeding, tinnitus, which is also called ringing in the ears, dizziness, heartburn, rashes, edema, fluid retention, vomiting, and constipation. Now let's talk about the recommendation of dosage and indications. So in conditions like pain, fever, dysmenorrhea, ibuprofen given over the counter, the dose is 200 to 400 mg orally every 4 to 6 hours and should not exceed 1200 mg. In case of prescription, the dose is 400 to 800 mg orally every 6 hours and not to exceed 3200 mg per day. In conditions like inflammatory diseases, the recommended dose is 400 to 800 mg orally every 6 to 8 hours and not to exceed 3200 mg per day. In case of osteoarthritis, the recommended doses are 300 to 800 mg orally every 6 to 8 hours and not to exceed 3200 mg per day. In rheumatoid arthritis, the doses are same as mentioned in osteoarthritis, so doses can vary according to the clinical practice of your doctor. And that was all about ibuprofen. This video is only for educational purpose and not intended for medical advice, diagnosis, or treatment. Always consult with your healthcare provider. Thanks for watching.